Institute for Health Metrics and Evaluation. Dr. Murray, thank you very much for being here today. I guess one of the questions that is most in people's minds when they hear these new numbers, and everyone is relieved, of course, to hear that the numbers are getting lower, is how could they drop so much from 93,000 all the way down to 60 in just a few weeks?
Well, first of all, you got to think about our models compared to some of the models that were out there that suggested maybe 1 million or 2 million Americans might die in this first wave.
But that was without social distancing and restrictions.
Without social, exactly. And really from the very first set of numbers we put out, we said that the range that was possible was 35,000 to 150,000, and every revision since has been well within that same range. The second thing you got to remember is this is sort of like forecasting the weather. We get lots and lots of data coming in, and you really want your forecast to be updated based on the latest data. There's information about deaths, the trends in cases, the trends in hospitalizations. We try to bring that all together and come up with the best set of estimates. And the new thing we've added now is we've brought in the cell phone mobility data that tells us state by state how much reduction in mobility there has been. And that's really part of the reason that our numbers have come down.
Yeah. Do you expect that they'll go even lower? The president just moments ago said, I think it's 50 or 60,000 now at this point. Is he right about that? Could it go to 50? What's your estimate when you look at the numbers?
Well, we're seeing some sort of divergent trends. So one thing that we're seeing was in New York, for example, which has had the biggest epidemic in the country. The peak has lasted much longer than anybody thought, including ourselves. And so that means more people died than originally we expected. And the other thing that's going to maybe move our numbers, in possibly up a little bit is all these deaths that were missed in nursing homes. And so as more states start to report on those missing nursing home deaths, that's going to raise up our understanding of what the past 3 or 4 weeks has been. But, that's probably going to influence numbers 10, 15% on the upward side. On the good news side is some of the trends in some of the southern states have been better than we expected. So it's a bit hard to know where the forecast will go with these two opposing trends that we're seeing in the data.
Yeah. Your data shows a straight line all through the summer, so no increase in deaths all the way through August. So what happens, is that accurate, looking at that, no deaths all the way through the summer, and then what happens after August 4th?
Well, remember, that straight line was premised on our original thought that the states would want to keep the social distancing measures in place until essentially there were no more infections in the community. And to do that, you would have had to run those social distancing measures nationally, at least out to June. It could have varied a little bit by state. As soon as we start to take off social distancing earlier than that, there is the risk of either getting infections back from other states or that the pool of people still infected in the community will be larger than what the public health service and the health system can handle in terms of detecting and contact tracing. So we start to run the risk of resurgence. When we start to see states taking off measures earlier, we will update our forecasts, and now we'll start to see the risk that at least the range will not be zero out in July and August.
Well, okay. Good things to watch for. Two other quick things for you. There's 2 studies in California that are starting to look at the population through the studies that they're doing. And those studies have showed that the number of cases that we know about, it looks like it is actually 28 to 80 times greater in terms of the number of infections in that state. What do you say about that? That would be, close to 30, 40% even of the population has had this infection and doesn't know it in terms of penetration. Does that sound right to you?
No, not really. We've been looking very carefully at these early antibody tests, and I think we, like CDC and other parts of the government, have concerns about high false positive rates in many of these early tests. Some of the better conducted studies that we've seen, for example, the Dutch blood bank study, which is, they measure everybody that's giving blood every week. Those suggest rates of 4% infection rates, which is exactly what our model would suggest. So we think that these early studies are probably greatly exaggerating the actual number of asymptomatic infections in the community.
Well, we'll see. They're both in California, so we'll see. Quick, before I let you go, here's the map, and it shows 4 states that could open as early as May the 4th: Vermont, Hawaii, Montana, West Virginia. Some of those are right next to dark green states that say June 8th or later. So what's to stop these viruses from flowing into these areas after they open on May 4th?
Well, that's the problem. I think Hawaii will be okay if they manage, as they have been, travelers coming in. But for the states that are right adjacent to another state that has a much later epidemic, that's the big challenge. That it's only going to work to open up earlier if there's a way to stop major reinfection. So if state governments don't think that's practical, then they had better pay attention also to the dates around them.
Yeah, lock down their state and not let anyone in, I guess, for a while until this thing continues to go through its course. Dr. Murray, thank you very much. We always look forward to these numbers coming out.